Difficulty standing and walking is one of the most common complaints that I hear about from people over the age of 60, and particularly among people with spinal stenosis or degenerative disc disease. Now, standing, stationary, and walking are different activities, but the underlying principle for both of them is the same. So first I'll go over that underlying principle, and then I'll go over tips to help you stand, and then finally, principles to help you walk better. So the number one reason why people with spinal stenosis or degenerative disc disease have trouble standing or walking for long periods of time is because as you bend backwards, that jams the joints in your lower back together, and it also narrows the spaces where the nerves come out of your lower back. Now, as you age, the discs in your spine normally start to dry out, and that's normal for everyone. But sometimes due to repetitive movement patterns at a single segment, one segment may start to dry out or degenerate a little bit faster than others. Now, that doesn't mean that you can't stand or walk comfortably anymore. It just means you have less tolerance or less margin of error to that backward bending. Additionally, because many people have been told to stand up straight most of their lives, and as they get older, they may start to bend over to relieve pressure off the joints and the nerves, but their children or their doctors will tell them stand up straight, which only worsens the problem. So if you stand with excessive arch in your back and you're in the habit of doing that, that can jam the joints in your lower back together. It can also pinch on the spaces where the nerves come out. Additionally, if you have central canal spinal stenosis, the type of stenosis where the space where your spinal cord runs becomes more narrow, if you stand in a lot of extension, one vertebrae can start to slide forwards on the other. And that can create a functional narrowing of the space where the spinal cord runs. So standing in extension with a lot of arch in your lower back is also bad if you have central canal spinal stenosis. So how do you decrease that? Well, this is where the tips for standing and the tips for walking become a little bit different. So when you're stationary standing, you need to balance your center of gravity over top of your base of support, which is your feet. If you lean too far backwards, you'll fall backwards. And if you lean too far forwards, you'll fall forwards. Now, if you have a lot of anterior pelvic tilt in your pelvis like this, because of tight hip flexors, you'll tend to lean forwards, and that puts you in a position where your center of gravity is not over top of your feet. Your back muscles have to work rather hard to hold you up to keep you from falling forwards. So instead, what a lot of people do as a compensation for the stiffness in their hip flexors is they'll stand with more arch in the lower back. And so stretching out the hip flexors is one good tip to help improve your standing tolerance. And I'll show you how to do that here in just a second. Another reason is because if you're too stiff and rounded in the upper back, then you have to compensate for that, again, by extending at the lumbar spine. So if you're too flexed in the hips and too flexed in the thoracic region, you have to extend from somewhere, and that somewhere is usually the region in between in the lower back. So to stretch out your hip flexors, one of the easiest ways to do that is just standing with a little bit of a stagger like this, and this is the hip flexor that you'll stretch in this particular exercise. So you'll roll your pelvis underneath of you like that, push your hips forward, and that creates a stretch on the hip flexor right here. Now I'm showing this for the purpose of being able to stand longer, but you may also notice that this looks very similar to the position that you'd go to push off with when you're walking. So this also helps your walking. And hold that position for about a minute. Now you may notice you can stretch a lot farther if you allow your back to extend, but you don't want that. So do a little pelvic tilt to flatten your back, step forward slightly, that stretches your hip flexor. You may also feel a stretch in your calf, and if you're only feeling it in your calf and not in the front of your thigh, it is okay and probably a good thing to have your heel leave the floor. Again, kind of like you're pushing off when walking. So calf stretch, heel on the floor, hip flexor stretch, heel off the floor like this. And again, keep the lower back flat. The next exercise to help you stand longer without lower back pain or without pinched nerves that cause pain or weakness to go down into your leg is standing back up against a wall like this. Walk your feet out a little bit so you're leaning back into the wall, and then you want to try to pelvic tilt and flatten your lower back into the wall. Now, it's very likely that for many, I'd say most people, that you'll have a little bit of rounding in your upper back, and that brings your shoulders and your head off the wall. So you don't need to be back like that. It's okay to have your shoulders and your head a little bit forwards, but keep your lower back flat on the wall. Now you bring your arms up like this and rotate your arms back towards the wall as if you're rotating your hands back towards the wall. You should feel a little bit of a stretch in your chest muscles here, and that's good because stretching out your chest muscles keeps you from being pulled into that thoracic kyphosis or rounding of the upper back. So this helps you learn to stabilize your lower back and keep it in a nice neutral position while you're extending through the upper back. Now, to combine that for standing, just think about doing the little pelvic tilt again here. You may have to unlock your knees. If you have some stiffness in your hip flexors, it may help you to unlock your knees just a little bit. If you can stand with them completely straight, that's great, but don't do that at the sacrifice of arching your lower back. So pelvic tilt, roll under there, and then lift through the chest, just a slight lift, not so much that you start leaning backwards, but that you can lift your chest up, keep your head neutral while you have your lower back in a neutral position. This stacks your head over your shoulders, over your trunk, over your hips, over your knees, and over your feet, and allows you to stand for longer periods of time without jamming joints together in your lower back or without pinching nerves in your lower back. Now, walking is not the same thing. It would be very difficult to stand like this and then try to walk. And in fact, it's almost impossible if you try it for yourself. The reason for that is as you walk, you need to be moving forwards. And that means your center of gravity has to come in front of your base of support in order to create motion. Now, if you try to walk like that, it's not going to work out really well. But keep in mind that what we want is slight lumbar flexion, or rather just coming back to a neutral position. When you stand, you do that from bottom up by tilting the pelvis. But when walking, you can do that by leaning your trunk forwards. Additionally, if you think about pushing off your toes, again, here we're back to that hip flexor stretch that we did earlier. Push off the toes while leaning forwards slightly. You're not walking hunched over like that, but leaning forward slightly while pushing off the toes and squeezing the glutes helps you to take a step while keeping your lower back in neutral. Now, what many people do is they'll pull forwards with their front leg, so they're using the front leg and driving by pulling backwards with their heel. And that heel strike pattern does a couple of things. One is you go to take a step, lifting the leg to do that activates your hip flexors, one of which is the psoas. The psoas can create a massive compression load on your spine and aggravate the joints or the nerves in your lower back. But the bigger issue is that as you go to step like that, it often kicks you back into extension. So much better off would be to push off the back heel and create your motion by pushing off this way, again, like the hip flexor stretch. Now, you may have to shorten your stride if you have stiff hip flexors, and the reason for that is because if you overstride, that's also going to create excessive lumbar extension. So you might have to take shorter steps initially, leaning forward slightly, driving off the toes, squeezing the glute, and walking, leaning forwards like that. So to see sort of in real time, this isn't a very long length, but it kind of look a little bit like that. It doesn't look really abnormal. It doesn't look like you're walking like that. Comparatively, trying to stand up tall where you're marching, it may look good, but it doesn't feel really good for your lower back. Now, if you try those tips and you still have pain or can't walk for as long as you like, using a cane or a wheeled walker to offload some of your weight so you don't have so much compression coming down on your spine is a good idea. Now, many people don't like using a cane or like using a walker because they think it makes them look old or feel old. But if you can't go out and do the things you enjoy, then what's it worth? Because nobody's going to see you anyway. So it is a good idea to use a cane or a walker for a short period of time until your muscles get strong enough to help hold you up without relying on that cane or without relying on that walker. Now, when you're using a cane or a walker, if you have one leg that is more painful than the other, you want to put the cane in the opposite hand so that you can offload some of your weight off of that leg. It seems like it should go on the same side, but when you lean to the other side, you're actually leaning pressure off of that leg and also opening up the spaces where the nerves come out on this side. Versus if you were to use a cane on the same side, then you're actually kind of leaning more over onto that leg and also pinching the nerves on that side a little bit more. Now, with a wheeled walker, it's a good idea to lean forwards on it a little bit. In fact, many people have probably found that if they're in a grocery store, if they kind of lean over on the grocery cart, that it makes them feel a little bit better. So it's okay to lean forwards just a little bit on a wheeled walker. And this helps, one, offload your spine because you're pushing up using your arms. And additionally, you're in slight lumbar flexion where you open up the space where the nerve roots come out of your spine. Now, there are also some braces that can help you stand or walk longer if you have spinal stenosis or degenerative disc disease. Some people worry that using a back brace may make their core muscles weaker or that they'll become dependent on them. And you don't want to wear them all the time, but they can be helpful to allow you to do activities where you know you'll be on your feet for a long period of time and you might otherwise be unable to enjoy those activities. This is one that I particularly like called the DDS 300 belt, and it's a little bit different than a normal back brace that just compresses around you this way. It actually has some air columns that inflate, and as you pump it up, the brace expands vertically, giving you a little bit of a lift. So it actually takes some pressure off your joints and off the discs and off the nerves in your spine. It's kind of like walking around in slight spinal traction or walking around in the water that unloads part of your weight to allow you to walk around more comfortably. Now, once you've got the brace inflated, you can just pop it off and then go around and do your activities. Now, one other concern for people with spinal stenosis is falling. If the nerves in your lower back are being pinched, it makes the muscles in your legs weaker. That may give you difficulty walking for long periods of time, but it can also make you a little bit more unsteady on your feet. Now, if you'd like to learn tips to improve your balance and stability if you have spinal stenosis, check out this video up here. But before you go check that out, if you find this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos.